Bismillahir Rahmanir Rahim. Alhamdulillahi wa kafa wa salatu wa salamu ala sayyidil mursaleen. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullah to all the participants. Some of you have your microphones on. Can you please put it on? It's echoing. Please put it off, sorry. Okay. To discuss this topic, first of all, in 1 hour is not going to be very easy, but I just want to give an overview, and mainly I want to point out what ADHD is not. So as we know, ADHD stands for Attention Deficit Hyperactivity Disorder. In the past, ADHD was called ADD, Attention Deficit Disorder. The hyperactivity wasn't really known. But before we go there, let us just underline the principles of Sharia and our belief in anything. And we know Allah Ta'ala mentions A'udhu billahi minash shaitanir rajeem, Inna Allaha ala kulli shay'in qadir, that Allah has authority over everything. There is nothing that happens, doesn't happen, except that it is by the will of Allah. So, and this was so aptly put when Hazrat Ebrahim alayhi salam was describing to Namrud who is Allah was, and he said, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ. And when I am sick, then it is Allah who cures me. And that is the underlying principle in our medicine, that whenever we are sick, we know that it is only Allah who is going to cure us. However, there is a hadith narrated from Jabir radiallahu anhu, that where Rasulullah sallallahu alayhi wa sallam said, أَنَّهُ قَالَ لِكُلِّ دَاعٍ دَوَاءٌ, that for every illness, there is a cure. And that is a categorical statement Nabi alayhi salam made, that there is a cure. Where the cure lies, that is for us to search for it. فَإِذَا أُصِيبُ دَوَاءُ الدَّاعِ بَرَأَ بِإِذْنِ اللَّهِ عَزَّ وَجَلَّ. And if you treat it, then it will only be cured by the permission of Allah. So this sets down basically the underlying principles of what our deen is. And first of all, it just gives us that every illness has been created by Allah subhanahu wa ta'ala, and every illness will only be cured by Allah subhanahu wa ta'ala. My apologies for that. Holy Boja, can you hear me now?
We can hear you. Please carry on, Doc.
Jazakallah khair. Until where did it cut off, or did you not hear at all?
No, we heard quite a bit of it until the hadith of Jabir radiallahu anhu.
Okay, Jazakallah khair for alerting me to that. Please keep an eye on that. So, in the hadith of Hazrat Jabir radiallahu anhu, Nabi alayhi salam told us in very categorically, likulli da'in dawa'un, that for every illness there is a cure, and if you take it, then if it is applied to the disease, then the illness will be cured by the permission of Allah subhanahu wa ta'ala and by nothing else. And in another hadith that is narrated by Hazrat Abu Hurairah radiallahu anhu, Nabi alayhi salam said, there is no illness except that Allah has also created his treatment. So that gives us that there are cures available, and we need to go out and seek cure, and to seek medical attention, to seek medical help is part of Sunnah. Tawakkul is the trust in Allah, but however, we are still, the Sunnah demands that we adopt some of the means. So the first important thing is just to dispel some myths, and as we go along, I will try and dispel some of the myths that have been fostered around ADHD. And the one is that ADHD is a learning disability. ADHD per se is not a learning disability. Maf, can I just request some of the people still have their microphones on? It's coming through. If you can put it on mute, please. It is not a learning disability, but it does affect children's learning severely. And you'll see why when I show you in a short while. Okay. It is a behavior disorder. No, it is not a behavior disorder. Behavior disorders are a very separate category of things which sometimes it can develop into a behavior disorder. Sometimes it can develop into a personality disorder, but per se, it is not a behavior disorder. It is and it isn't a mental illness, depending on how your different definition is. But it is certainly not madness, because what people regard it as that it might be, it is madness. Okay? It is a new and modern disorder. It was discovered, or it was first noted and written down in the early 1900s, and has been treated since then, and we'll cover some of that. It is caused by bad parenting, too much screen time, too much sugars, too much chemicals, too much this, too little that. And some people are of the opinion that ADHD children just need a lot more discipline. Yes, I agree. Every naughty child does not have ADHD. But there are a lot of children battling with the ADHD who people just say they are naughty children. They are badly managed. It's poor parenting. And research has shown that this is a fallacy. ADHD is not caused by bad parenting. And certain things do make it worse, but it's definitely not the cause of it. So some of the other things, to dispel some of those myths, to dispel some of those myths, ADHD is not a real medical condition. It is a very real medical condition. And if you see the difficulties if you see the people that go through it, Mark, can I please request to put your microphones on mute? It's very distracting. I'm battling to hear the background sounds. It is not a real medical condition. It is every much real as your diabetes, hypertension, and children truly battle with it, and adults. It's not just the illness of childhood. Okay. Sometimes, like we do, we tell people with depression to just snap out of it. We tell them to just focus. We tell ADHD children just behave better. Not true. Only boys have ADHD. Not true. Girls have a type of ADHD which is actually more sinister, because it is the quiet, inattentive type, and it makes it a bit more difficult to detect. Usually we find this rowdy, naughty boy in school, gets into trouble repeatedly, and so he comes to attention sooner. But with the girls generally, and this is just in general, they have the inattentive type, and I'll tell you a little bit more about it. All kids with ADHD are hyperactive, not necessarily true. There's two types. There's the hyperactive type, and there's the inattentive type. So the inattentive type, you don't see them. They just the daydreamers, and it happens to boys and girls. Okay. In terms of statistics in South Africa, they estimate, and our statistics are not always accurate, 1 in 20 children are suffering from ADHD. Okay. And ADHD, even in its mildest form, is debilitating, because it's not just hyperactivity. If you understand, it's not just the body that's jumping around, the thoughts are jumping around. Add to that they estimate that there's 1 million adults who have ADHD. And this is a very serious thing, because that means there's 1 million people who are battling to cope with their lives, who really don't understand what their illness is about, or even that they understand that there is an illness. So the overall statistics in South Africa and internationally is between 5 and 7%. That means if you take in a class of 30, you can look at 1 to 2 children having ADHD. And generally, there's the naughty one, there's the guy who causes a havoc in the class, or she is the one, the dreamy one, always looking out of the window. And nobody's really understanding why this child is behaving like that. What's the problem? The children present usually at 3 to 6 years, and we don't diagnose it before 5 years usually. Okay, the different clinicians differ on when they diagnose it. Some say not before 5 years, some say not before 3 years. There's been a huge increase in the ADHD cases over the last 8 years, almost 42%. Whether that is because we are diagnosing them better or whether it is an absolute increase, because previously these were just regarded as the naughty children. They were left to their own devices. Many of them managed to survive. They continued, they struggled with their relationships, they got married, they got divorced, they got jobs, they got divorced, they got friends. And it just became difficult, but they managed through life. Now we've seen this huge increase of 42%. And it may be because we are diagnosing them better or because people are more alert to it. There's what I had mentioned to you earlier. It was first documented in 1902. And since then, it's been treated from 1937. We've been using psychostimulants and we've been using amphetamines to treat it. So it's not a new illness. It's not something that's like of modern day. When we come to international statistics, it's very similar to our own. In certain countries, like you'll see in New York City, it borders on 12%. And in certain other countries, Ukraine, this is not recent statistics, this is very old, this is 2000. Even then, it was bordering on 20%. If you look in the Americas, and this just gives you the significance of how it is, they have 6 million children diagnosed with ADHD. 6 million children. Now that's a significant amount of children. And these children are battling. Because generally, as I say, parents or caregivers or teachers don't recognize that it's ADHD. They start then ridiculing the child. They then say he's a bad child, he's a naughty child, he's a whatever. And the child grows up with, apart from just that, the child grows up with a huge complex. 7 is the age when most of the children are diagnosed, and generally we have twice as number of boys as girls. Whether this is because the boys, as I say, they generally have the hyperactive type and they are more prone to being detected because that's the one, the fidgety one in the class. He's the one who refuses to sit down. He's the one who's always busy. So maybe because of that, the girls, I'll show you some of the symptoms and you see it's very subtle generally to pick up amongst the girls. Okay. This statistic of 70% is very significant, the percentage of adults who respond to treatment with stimulants. In other words, it's a very treatable illness. And it really, we can help a lot of these children with, when we diagnose it, when we put them onto medication, a lot of them are able to almost function near normally. And when we come to the treatment, we'll discuss some of the myths that Ritalin doesn't zombify you, etc. This is pretty much the same as the other one. So I'm not going to go into it. But here in the Americas, you can see the interesting trend amongst their Black population, whereas the white and the Hispanic population has been growing steadily, but the Black one has seen a rapid rise. And some of them have postulated is just through better diagnosis. So in terms of statistics, we're sitting with a huge problem, because if we're saying 5%, that means in a school of about 700, you at least got about 30, 35 of these kids that are sitting with a problem. And eventually they get thrown from one school to the other school. And ultimately they just drop out and they just become problematic teenagers. And they also go on to develop other illnesses. So let's look at some of the causes. We don't know. If you ask me what's the cause, we don't know. Some people, there is a definite genetic connection. And very often we diagnose ADHD adults when the child comes and the child presents with ADHD And then we ask them other questions, and she says, yes, I'm like that, I'm like that, I'm like that. And you pick it up that you pick up the mother's diagnosis from the child, not the other way around usually. But if you have ADHD, the likelihood of you having a child with ADHD is very, very likely. Other causes are environmental factors, chemicals, but very important is psychological trauma. We found that a lot of children who come out of very acrimonious divorces, children who come out of war environments, children who've had a very disturbed childhood or who've been molested during childhood, they develop ADHD or something worse. Let's get to the symptoms. And so what do we see in these children? What does an ADHD child present? Because by and large, our clear understanding is a fidgety child who can't sit still, is busy all over the place, or she is busy all over the place. So one of the myths is that ADHD is a simple case of being hyperactive. Some children are hyperactive, but they don't have ADHD. They just got like a boundless energy that they, from morning to night, they're like on Duracell plus batteries. And they tire mother and father out, but that doesn't make them ADHD. ADHD is a very complex diagnosis that requires a lot of appreciation of what they do. But generally, hyperactivity is one part of it. So the crux of the whole problem is they lack concentration. And this is not because they're not trying. They try really hard. And these kids, as I say, battle in school. So we have basically three main elements. We have the inattention, where like they'll be sitting there in the school, the teacher's talking, and next thing they hear a dog barking in the way distance, and they're gone. And they'll hear every fourth, fifth word, and the teacher will say, you know what, Fatima, why aren't you paying attention? What did I say? Not a clue. Not a clue. She wasn't there. Again, okay, now pay attention. Come sit right in front of me, come pay attention. After 4 minutes later, Fatima's gone again. It has this inattention. They cannot focus on anything. Or they have the hyperactivity, and coupled with that, they have impulsiveness. My good friend, Dr. Jiva, may Allah bless him, he passed away, but he used to say ADHD, and he was a sufferer of ADHD, so he understood the illness very, very well. And he had few family members, as I said, there's a genetic link in it, who also had ADHD. And he used to say, it's like having a Ferrari with bicycle brakes. Okay, so they have this impulsiveness. They just go out and do whatever they want. They don't think it through. They don't have like a thought process to say, if suddenly he decides he needs to go and write on the board, he gets up and he goes and write on the board. And the teacher's like, what are you doing, Musa? What are you up to? And he's looking at her like, what's the fuss? Whereas every other child will be petrified to get up in front of the teacher and walk to the board and draw a picture of his mother. But these people don't have that. They got brakes of a bicycle on a Ferrari. Added to that, as they grow older, they get ADHD with everything around it. In a few cases, you don't find only pure ADHD because the brain doesn't work in compartments. So you find them with ODD, you find them with autism, you find them with OCD, you find them with depression. Many of them get depression because their life is just too difficult. And many of them then go on to develop personality disorders. So if you look at the symptoms, then from the three categories that I stated, inattention, the first one is they have a very difficult time paying attention. They will sit in the class, they're very quiet, that's why you don't pick it up, and this is often how the girls present. You don't pick it up, they're very, very quiet, they sit, but they're not there, they're not in the class. So they might be looking at the teacher, but the teacher can see that, yeah, the windows are open, but there's nobody inside. And then she starts shouting and the child comes back. But again, they drift off. They often don't seem to listen. It's not that they don't want to listen. Their brain is gone. It can't stay focused. Okay. They're very easily distracted from work or play. They'll be playing with their friends. Next thing they're off to sitting there and looking at a little bird. Then they forgot about the bird and they move somewhere else. So they keep on exactly how they cannot sit still. Their brain can't sit still. They keep jumping. And this makes it impossible for them to learn. Because to learn, you have to remain focused. You have to concentrate on what's being said. Usually it's like a one thought leads to the other. So the teacher says, this sum like this, then we add it now, add another number. They lost because they weren't there for the first two. Okay. They don't follow through on instructions. They're very disorganized because they can't stay focused. They lose a lot of important things. This is the child, Baba, where's your jersey? This is the third one for this term you lost. I don't know, Ma. But what do you mean you don't know? Didn't you have it? I don't know. And then the child gets called all sorts of things because, yeah, it's the third jersey you lost for the term. And you a problem. But we haven't recognized that this child's got a problem. They forget things. And they'll avoid things that require a lot of mental effort for the simple reason it's just too difficult. Then you got the hyperactivity, and as I say, it's not perfectly in these silos. You get people, some who have the combined type, they have all of this. So they go from inattention to hyperactivity. The hyperactivity is the one that we see. The kid runs all over the place. He doesn't sit still. He's busy all the time. He talks a lot, Allah. And he talks, his thoughts also, when he talks, he's talking now, he's telling you about the cat. Next thing he's telling you about what Joe did next door. Then he's telling you about last week we went on an excursion, and he just doesn't settle. His thoughts are just as volatile. And then finally you get the symptoms of impulsivity, where they frequently act and speak without thinking. As I said, he went to draw a picture of his mother on the board. Sorry, Appa, you don't like it. I just felt like doing it. Mind you, sometimes that can be harnessed into a very good trait. One person that we know, Richard Branson, who's the creator of Virgin Active, Virgin Airlines, his impulsivity gave him the ability to do things that nobody else wanted to. When everybody said you cannot take air balloon into the stratosphere, he said, I'm doing it. So it can be harnessed, and not all ADHD people are failures. So he'll run into the street, he won't think. The problem is when they become teenagers, they indulge in very reckless behavior. So this is the guy who will drive without thinking. He's the one who will go into a relationship without thinking of the consequences because he cannot work out the consequences. So you got the main two types is the inattentive and the hyperactive, active, and then you got the combined ones. And all these things they have within them. So now you can see how this child is battling at school. First of all, the teacher's constantly going on with him or her because they're not paying attention. The homework is never done. Or we did the homework, but we forgot the book. Or we did the homework, but we forgot which page we had to do it. Or we did 3 different exercises, and this kid gets criticized, and he's forever in the office. And because he's got brakes of a Ferrari, so he tells the principal what he thinks of him. Now, even more trouble. Parents are called in. Your child is like this, like that, like that. And nobody is saying, have you investigated the possibility of ADHD? No, we carry on and we badger this child. By the time the child is a teenager, either they're on drugs or they're in a depression because we have not given them the support. So once more, just to look at quickly, the inattentive, they're very easily distracted. They struggle to learn new information. They resist tasks that require a lot of mental energy. They rather just dream, okay? They lose their stuff. The hyperactivity guys are all over the place. If it's his turn on the slide, or it's not his turn on the slide, he's not waiting for anybody. is going on there. As they grow older, you start seeing other symptoms coming, that they're very prone to anger and they're very hot-tempered because they have no breaks. So if mother says something, this guy will go at attention. And, you know, how can you speak to your mother like that? Sorry, there was no breaks. Okay. They have difficulty following even the most basic instructions. So you'll tell him, Yusuf, when you finish bath, pack your clothes away, then go and help your sister. Now, Yusuf, he forgot to bath. Then he forgot about the sister. Then he left her outside. Like nothing. And to them, it's like not a major problem, but he genuinely is not doing it out of disobedience. Their brain is all over the place. Okay. So a lot of what we see, we call it actually the ADHD iceberg. Okay. What you see there, you see the fidgeting, you see the kid distracted, you see the impulsive behaviors, the teacher sees the concentration issues, and they say, this is one hell of a naughty child. Call the parents, call the parents, call the parents, parents sit down, fourth meeting, fifth meeting. And nobody's saying, shall we look further? Because at the bottom, there's a lot more things happening. In an iceberg, we know the tip of the iceberg is what's sticking out. And the rest of it is hidden. And what is hidden? They have sleep issues. They have mood shifts. They have poor time management. They can't process information. They can't keep relationships, so they don't have friends because he'll be sitting with his friends and he'll just say what he wants. All the girls are sitting and our little one is looking into the sky and they're all talking to her and she's not, so it looks like she's ignoring. She loses her friends. They have executive dysfunction, means they can't process things. They have emotional deregulation. As I say, they got no breaks. So they just do whatever they're supposed to, what they think should be done. And the same thing, you see it with teachers. The teacher sees that he fidgets, he runs. Exactly, you'll get those same. And please, I must underline, I'm not saying that every naughty child has ADHD. But look at it carefully, especially teachers. Look at the child and see, okay, he comes from a good home, he comes from a stable home, but this kid's battling. He's battling to learn. He's battling everything in his life. He's like just walking uphill all the time. It's very, very difficult for the child, and we need to be sympathetic to these kids. They are not going to come right on merely talking to them, shouting them, hitting them, and all sorts of other interventions that we think. Even loving them, you still don't get the response because you think maybe it's a lack of love. So it's a very challenging environment for the child. He's at school where school demands conformity. He's in a place where you've got to have regularity. And these ADHD kids and adults lack regularity. One of the treatments that we do is we tell them you've got to have a routine because a routine gives them regularity. And from the regularity, they are then able to construct something of their lives. So when it comes to diagnosis, how do we diagnose them? I've given you the symptoms and I've given you some idea of what they're about. And one of the things, as I say, you've got to look at what's underlying, that ADHD triangle that I mentioned, that iceberg. What we see is just a tip of what this child is going through. And because the child is he's 7 years old or she's 7 years old, she can't possibly articulate that I can't. And first of all, they don't even have a sense of normal. So isn't it normal for everybody to think like this? Isn't everybody struggling with the homework in the class? Doesn't everybody listen to the birds outside? And they don't understand that that is not the normal. You have a problem that we need to help you with. So they have specific learning disabilities. 25 to 50% don't make it at school. Okay. They have a very poor working memory because, as I say, their thoughts are jumping all over the place. So there's no ways those neurons can form a memory, because as soon as the one is firing and setting itself a memory, the thought is gone somewhere else. They have very poor listening and reading comprehension. They have difficulty in describing the words, okay, in words. So if you ask them, what is a bicycle, they'll point it out to you in a picture. But tell me about a bicycle. They struggle because their brain is all over the place. Just as their body is all over the place, the brain is everywhere. And it cannot focus, it cannot go fetch the thoughts like you. And if I asked you, hey, do you remember your wedding day? Yes, I remember my wedding day. They can't. It's there, but they can't fetch it. So they have difficulty retrieving memories. They have a lot of challenges that we don't really appreciate. They're very disorganized, very disorganized. So if the timetable is like this, Johnny brings all the books. And Johnny's mother is now so fed up, she packs all the books. Doesn't matter if we need 2 wheelbarrows to take this, but because he cannot look at his timetable and say, today, first 2 periods is maths, then is English, then is history, then is Afrikaans. I don't need my life sciences book. He can't do that. Next day, his life sciences, he forgets about it. Okay.
Abu.
Umi?
Put your mics off, please, man.
What's this? English, no? Since the contents, lol, halal. No, what's this? What's this? What's this? It's mine. That's my baby. That's not my baby. That's not baby.
Assalamu alaikum wa rahmatullah. Maaf for that. Dr. Saab has just been, I'm not sure what has happened. There seems to be a small technical glitch. Inshallah, we're starting now, and then the program will carry on as normal. Can we just request everyone that if you could please just mute yourself? I'm manually muting all as we come along, but it's just becoming challenging. Jazakallah. Inshallah, what will happen is that after the program, we will upload the recording of the program on the YouTube. So it will come as a continuous slide, and then everyone would be able to view it from there. And there would be a small question and answer session after the program, inshallah.
Ah,
Sorry about that, Dr. Saab. The
Maaf, I don't know why.
ADHD was too many places. I'm so sorry.
Okay. Is it there now?
Gee, we're there now. You just need to share the screen, and then we should be up and about, inshallah.
Okay, sorry about that. Yes, share screen. And there we go. Is it visible, Ma?
Gee, it's visible.
Yeah.
Just
Okay.
open
Yeah, I'm
yourself
just
on
going.
the main screen. Then at least in that way, we won't have that small stuff that's there.
Or is it there on your? Sorry. Okay, where's the unput?
Okay, just carry on. It's fine. Not a problem. Just share the screen, and then we can carry on.
Okay.
I'm just going to turn your camera off, though.
Jazakallah. Now what did I do? Okay. Is that visible there, Mona? Is this? I don't know how to unput this.
See, everything is visible. Everything is fine.
Is it okay? All
See.
right. So, as I said, those 4 factors have to be there. It must be before the age of 12. After the age of 12, then it's a different diagnosis. It has to be in 2 settings, and it must interfere with their work. So having just being an irritable child or just having psychological issues is very different from having ADHD. I just want to talk a little bit about ADHD in adults, because we're seeing it and very many adults don't know. And sometimes when you go through marital problems and you pick up that there's a possibility of ADHD here. And one of the myths that we face is that children outgrow ADHD. About 50% when they reach teenage years, 14, 15, they start growing out of those symptoms. Some of them, inshallah, we hope and we pray that they end up with no residual effect. Some of them then go on to other kind of psychiatric illnesses like OCD and borderline personality disorder and things like that. But 50% will still have their ADHD with them. And that's a significant amount of it. So if you look at it, as I said previously, in childhood, the prevalence is 4 to 7%. About 15 to 65% go. So basically about 2.5% of adults will have ADHD. So what happens in adults? They have similar problems, but because now they're a little bit more sophisticated and the brain is a little bit cleverer, it knows how to mask it. So you see, these are the people who battle at work to get it. They're never on time for a meeting. They can't manage their time. They've got time planners, they've got all sorts of things, diaries, they've got books, it's just not making it. They don't focus on what's important. They've got a task, they've got a deadline, they're sitting there, go flipping through their emails. They, again, the lack of having breaks. So in a meeting, they will just say it. They will just say whatever they want. And it can be very inappropriate, okay? They keep things in mind, so they don't have like a storage memory and a working memory. That mind is all over the place, okay? Very much the similar things, except now that adult has learned not to fidget so much. They've learned how to control themselves to look normal, but it does cause a huge problem. And you can see it in a marriage. Imagine you've got somebody who's the inattentive type, and you're talking to your wife and she's gone. And after 3 minutes of speaking, and I just mentioned to you about what happened at work. Oh, I'm sorry. First time forgiven, second time for. Or you tell us, I know this, like not ADHD, but most husbands buy milk and bread and they forgot. ADHD forgot, you know what, where they were going, and they ended up going to buy popcorn, come home and say, here's the popcorn you asked. Because they just follow what they do. And one big problem they have is they cannot control their emotions. They do not have the ability to control it. So, as I mentioned, women have a slightly different picture generally, but they have difficulty focusing, they are disorganized, they have little control over their time, their money. You see their homes are not very orderly, they don't make clear decisions, and you can imagine a home with this happening in that place. So you see, usually these are some of the indicators that the adult may be, and I'm not saying every one of these things definitely indicates that the person has ADHD, okay? So you see them dependent on nicotine, or sometimes worse. You see them being very impulsive. They have a lot of addictions because they got no controls. They cannot stay focused on anything. So they make routine errors. They're very restless. They cannot relax. They don't sit down and watch a movie. They got to fidget. They got to, in fact, if you remember that fidget spinners that came out not so long ago, that was a very favorite toy with a lot of kids, were actually developed to help ADHD people concentrate. They daydream, they lose things all the time. And one of the things, as I mentioned, having a child with ADHD could indicate that that parent has ADHD. They have trouble maintaining relationships. They go from one relationship to the next. So we come to the point of treatment. And basically, we're faced with a few common treatments that we use. The one is CBT, or allied program. CBT is cognitive behavior therapy, where we try and change the thought process. It takes a while. You need a decent CBT therapist. Your average CBT therapy takes between 8 and 14 weeks to develop. You're teaching them the tools of handling their thoughts. Then we use what we call stimulants and non-stimulants. I'll discuss a little bit with that, and sometimes antidepressants. Some of the behavioral therapy that we use under CBT, we use behavior modification, we use behavioral parent training. So we teach the parents, we teach the school, we teach everybody involved in that child how to deal with the situation. It's not only about we drugging them or we just giving them meds. It's a coordinated effort of everybody to help this child survive a very difficult situation. And when it comes to medication, there are two types, okay? The psychostimulants, Ritalin, everybody knows. The older one was Adderall. Now we've got newer ones, which are non-stimulant medicines, like Strattera, Intuniv. Capvey is not available here yet, but it's coming. And they found generally that a combination of psychostimulants and non-stimulants works best. Now, this is in the realm of psychiatry, and I'm not even going to pretend to discuss it because it's just going to confuse all of us. But I just want to say something about Ritalin, which we all know is a horror drug, and it does all sorts of things, and it turns your child into a zombie, and their brains get holes and everything else that you can imagine that people have said about it. But the honest truth about Ritalin and a lot of these drugs, you use it correctly, you're going to give your child an opportunity to be near normal. They can actually focus in school. They don't need specialized schooling. They don't need any special kind of, they don't have a learning disability. They have a brain coordination disability. He can learn perfectly well. Get their brain to sit down and watch how these kids do. And that's why I say giving them the medication helps them, but it needs a little bit of titration. It needs to be worked out what is best. So some of the myths around Ritalin is that Ritalin is a relatively new development. It's been used for over 45 years. And dexedrine was used for 10 years before that, which is similar to Ritalin. It was just Ritalin had less of an abuse potential. So Ritalin is not a new drug. It's been used, as I say, it's now 45 to 50 years with near zero fatalities. We've never had a death from Ritalin. It does have side effects. It does have problems. With every medication, we have problems. But if used properly, it's like telling a diabetic, okay, so we're going to give you metformin, you're going to have stomach problems. But no, the stomach problems are too severe, don't take it. You rather just go on with your diabetes, develop cataracts, develop heart problems, have a miserable life. It's an offset, benefit versus harm. Ritalin is a gateway drug to other drug abuse. It's when Ritalin is abused, and it's being abused by some people, especially stuff like Concerta, and that in America has now become a problem for abuse. That's why it's a Schedule 6 drug. You don't get it without a original written prescription. So somebody who's been using Ritalin as a drug, that person is going to continue to other drugs. That person is not using it, but when we use it for ADHD, they don't go on to any drugs. They don't get addicted to Ritalin. You can switch it on and off, and you see the symptoms. Ritalin is like cocaine. There are chemical similarities, but cocaine has a different effect, and Ritalin has a very different effect. Ritalin is so bad that there was a lawsuit filed to stop people from getting it. To date, there were 5 lawsuits filed. 4 have been dismissed, and the 5th one, if you ask, was withdrawn by the applicants. So there's no case against Ritalin. The medication will make a person a zombie. The idea is that it will take away their personality. That is common. What happens is you see this child who's very busy, who's highly active, who's all over the place, suddenly become a quiet child. It's a little bit of a play off because, yeah, now he sits quietly, but his brain is also quiet. Now he's able to learn. Now he's able to focus on things. Now, so yes, we did lose something. He's no longer the laughing, bubbly person, but we didn't kill his laughter. If we manage it with everything else, together with taking the medication, we should be able to give him a near normal life. Some of the other treatments that we do use, and there's a whole lot of them, the brain germ, CogMed, omega-3 supplements, but these are adjuncts to the main treatment. Without drugs, we find it very difficult to get these kids under control. Yes, you can try cupping, you can do hypnosis, you can do acupuncture. You'll get some effect. You can use lavender oil, you can pour it on their heads. But to date, I have not found it where it gets the child to be able to focus, because you're not working from inside. You're working on the outside. Some of these things don't get to where we want them to get. So there's a lot of different things. And as I say, it is a multifactorial approach. You don't approach it only to say, here's your meds, great stuff. We need to bring the teachers on board, the parents on board, the siblings on board. Everybody needs to know what's going on here. Yeah. Little Musa is not mad. Little Musa is not a rebel. He's got an illness which we are helping him with. Please be kind and understanding. We are sympathetic to those who have cancer. We are sympathetic to those who have heart problems. But when it comes to mental illnesses, we actually look down on these people. And that is a very, very unkind way of dealing with people. So, in a nutshell, our treatment includes all the things, the non-pharmacological therapies, the pharmacological therapies. We have behavior therapy. If you see it in a decent center, it's very well structured, it's very well organized. They have proper exercise programs. Exercise helps a lot with ADHD. The more they exercise, the more it seems to improve the brain functioning. Their diet, but not a restrictive diet. We just cut out certain food, certain sugar, colorants, certain things like that. Excuse me, we don't go for a radical diet. In America, currently they've got 62% of children that are suffering from ADHD take medication. Add to that another 40%, 47%. For a very mild ADHD, you might get away with just adjunct therapies. But for a severe one, you're going to battle. Okay. And ADHD treatment helps. It helps manage the emotions. It helps improve learning. It helps reduce impulsiveness. Watch this child thrive. Otherwise, he's battling with his relationships or her relationships. And in school, we all know we form relationships, which group you with, all that, it counts. If I'm the outcast, I basically setting my child is going to be a problem teenager, and he's going to grow up to be a problem adult. Partly because of ADHD, but partly because of the rejection and the ridicule that the child faced. Their learning improves, so they can actually make it through school. And because you reduce the impulsiveness, he's not always in the office, or she's not always in the office, or in the manager's office, to say, you know what, Johnny drew a picture of his mother on the board again. So ADHD is a real illness. It is debilitating. Like a person with a broken leg, we're sympathetic to them, we forgive them. If they can't walk fast, they can't participate in the sports, we make them laugh. When it comes to ADHD, we criticize these children. You're being naughty again. You're being like this again. You're just a bad child. You're an ungrateful child. You're this, you're that. Imagine what happens to a child's self-esteem. It makes a person non-functional because you can't work at school. They drop out. Many of them drop out. And that poor child has no clue what's happening to them. No clue. So they really do need help, but they need professional help. This is not your average GP's cup of tea where you walk in there and I say, right, let's see, we tried this, we tried that. No, this is the level of psychiatrist. And going to a psychiatrist does not signify that you have lost your marbles. Going to a psychiatrist is like going to an endocrinologist for your diabetes. It's a specialist. And I would go so far as to say, go to a psychiatrist who is focusing, who's like a super specialist on childhood illnesses and particularly ADHD. And lastly, just to underline, every naughty child is not ADHD. So sometimes it becomes very tempting to just, hey, this kid got ADHD. Let's get the parents, go and get him evaluated. Go and have him evaluated if you genuinely think, but don't use it as a cop-out. Sometimes the child has got other problems. Maybe there's relationship problems in the home. The child needs a lot of love and care. We need to attend to that and we need to address that. I hope in the short time you've got some insight into ADHD. It's a huge topic. There's a lot of new medication that's being developed. there's a lot of new understanding coming through with the new scans and that we have available. So we hope that we will be able to better treat these children and adults so that they can have a normal functioning life. Jazakumullah khair for your time. I appreciate you listening. And if you do, please contact an appropriate professional.
So Doc, before you go, we just do a few questions. I'm going to read all out. You can do all of them together, and then we can close on that. The one says, can you recommend a doctor that can help us? We used to go to the late Dr. Jiva. We are not finding a nice psychiatrist. The second one, I know this is slightly off the topic, but is there anyone that knows of schools in and around Lodium that are remedial, willing to teach children with ADHD and understand their challenges? Another one, can you recommend someone that helps?
Stop. Let me take the first one. The psychiatrist, it depends whether it's Joburg or Pretoria. There are one or two. Unfortunately, they're very, very busy and preoccupied. Some of the bookings take like about 3 to 4 months. But maybe if you could get the person's details and ask them where they are, then we could share that information with them. As for schools, there are 2 or 3 schools in not in Lodium, but in Centurion area that do deal with younger ADHD children. And they focus specifically on that.
Okay, the next question is they're looking for a recommendation. I'm just taking 3 in 1. Someone that can assist but is not very expensive.
Unfortunately, these people are ridiculously expensive. The good ones, the state offers very poor support for ADHD. There are state psychiatrists, but they're so busy dealing with like HIV-related psychosis and post-COVID psychosis. They put this one almost on the back burner.
Okay.
I will try and find somebody who's reasonably priced, but on average, a psychiatrist consult is like 3,000 rand an hour.
Oh, so the next question, are there any Islamic therapies, either through Sunnah medicine or parenting, or specific du'as that can be used in conjunction with the medication, behavioral therapy? Also, what's your views on homeschooling for ADHD kids?
Okay, let's do the homeschooling one. It takes a lot because they need a lot of attention. So if mom or whoever has got time to do that, then by all means. But also, they then don't develop the ability to interact with other children. And once they're on medication, they are near normal. So they need that kind of interaction. But for the time that you're getting them under control, you can try homeschooling, but understand they become a handful because you need to still, as I say, we don't drag them to a point where they sit still for 5-6 hours. He's still going to jump up every now and again. And maybe because it's mommy, there's a little bit less control. So he's all over the place. It makes it a handful. As far as Islamic and adjunct treatments, by all means, every dua that we can use, there are specific duas for illnesses, as every wazifa that Nabi alayhi salam taught us. In terms of Islamic medicine, I'm sure there is a cure, because as I mentioned earlier, that for every that for every illness there is a cure. But it means, and generally, the Hakims would treat this with extreme diets, and you battle to get the kids to follow a diet like this. You restrict like 80% of what they're allowed to eat. So there are treatments, but on a practical level, I've either found them to take too long or they become very difficult. But I can't say they aren't, because I'm really not at that level where I can say in tip or something there isn't. There should be, but from practicality, this child needs attention. You cannot wait a year for him to settle down. They're battling now.
A few other questions, I'm just clustering it. In terms of teachers, what can teachers do? I suppose that's a very broad answer, but what can a teacher or muallim do to assist a learner who's ADHD?
Okay, first and foremost is identifying them if they haven't been identified. So if you suspect a child is hyperactive, because the honest truth is our educators and teachers spend 8 hours plus with the learner, and they have, you know, intimate workings with them, so they have a good overview of the child and their behavior. And when we do assessments, one of the assessments we do is we ask the teachers to fill in a form, the parent to fill in a form. So you're getting it, as I said, from two different places, and you're getting it from multiple dimensions. Once the child is diagnosed, the teacher can be a bit more understanding, knowing that the child's got a bit of difficulty. So yeah, if he forgets his book a little bit more than the other guys, give it a break. Understand that you need to help, and do not criticize. Please do not criticize. The child has a problem. It's like telling the kid with a broken leg, you must run faster. Okay, so, and if you can't run faster, then you're hopeless. And that is the worst thing we can do to a child. So if they understand the problem and they understand the child and they are sympathetic, I'm not saying to the point of like now tolerating him running around the class and creating havoc, but just understand. And when we understand, then our entire approach to the child changes.
If a child takes Ritalin, can they attend normal school?
When a child takes Ritalin, they will attend normal school. Prior to that, they better. So
okay.
Ritalin helps them to achieve what we call near normality. It's got side effects, but it's basically giving the child an opportunity to go to a normal school.
The next question, how often is ADHD misdiagnosed as bipolar? What are the similarities between the two?
In children, very rarely.
Okay.
Very, very rarely in children. In adults, there is a possibility because their behaviors are erratic, but the bipolar ones have clear cycles. They're either up or down. Bipolar is not, as many of us think, that in the morning is up and in the evening is down. Bipolar is basically, they have cycles. The shortest cycle is 2 weeks up and then they go down. So it's very easy to spot the difference, because a child or adult who's impulsive, he's impulsive all the time. Whether he's up or down, they don't cycle and they don't go. Sometimes they're in the inattentive phase, sometimes they're in the hyperactive phase, but it's not anything like bipolar. And a trained psychiatrist will be able to spot the difference very easily.
How long does it take for medication to take effect on the learner?
We start seeing within a very short space of time. It takes us a bit of time because some psychiatrists start with high doses. Then you have to like get rid of the side effects. Others work their dose upwards. So give or take a month and you see the child already starting to cope at school.
What are the benefits of administering Ritalin in an autistic child?
Autism, there's a different, because now we don't talk about autism per se, we talk about the autism spectrum disorder. And because it has a spectrum, there's different levels. So in some of them who become like almost borderline ADHD, and they have that hyperactivity, it does help some of them, but not all. That child needs a formal evaluation, and a psychiatrist must be the one to tell you if Ritalin is going to work here or not.
Another question that's coming in is, does Dr. Saab have a consulting room?
You can answer that for me.
Dr. Saab is extremely busy. He's involved in teaching, in adult education. He's got a business. There's so many things he does, but mashallah, I don't know how he gets the time, but really Dr. Saab is very busy, but always willing to assist.
if
Dr.
we
Sab,
can,
there's
I
so
mean,
sure.
gee,
There are many
sorry,
other
you were saying, Maulana?
questions. I say
Yeah.
there are many other questions. But what I'm going to do
Right.
is I'm going to leave my email address here. Whatever questions
Okay.
come, you can forward it to me. I will forward it to Dr. Sab, inshallah. And as he has the time, he will try and see what he can attend to, and then the necessary contact details for people that we possibly could look at in terms of giving them details of saying that these are some of the people you could assist. That would be great.
Okay, that would be excellent, Maulana. If you could do that, then we can let them send you the email and we take it on from there.
We just take it from there. I'll just help you facilitate it. I know you're very busy, so we'll just try and
Please,
do that, inshallah.
gee, if you can, that would help a lot.
It's been an excellent program, and we would like to say Jazakallahu khairah. And then if there is anything, our office number is on the poster. We may be contacted, and we will try and facilitate as best as we can.
Jazakumullah khair to
Assalamu
everybody for taking
alaikum.
your time out. Assalamu alaikum.